we are going to learn about the partograph. So what is the partograph? So start off with questions. The first question is, what is molding? What is molding? The second question is, what is the alert line? What is alert line? And then the third question is, what is the action line? So in this video, we'll find out the answers to all these questions, and there are some bonus questions in the end of the video. So first, to start off with, we are going to look at the WHO modified partograph. So that is in the year 2000. So first, to start with, there is no latent phase. There is no latent phase. And next, we look at the vagina, that is a vaginal examination. So this vaginal examination, this should be done in no less than every 4 hours. So no less than every 4 hours to assess the cervical dilation. So it is used to assess the cervical dilation and also the descent. Cervical dilation, there is descent. There is a descent of the fetal head. Descent of the fetal head. Next, there is also the molding. There is molding, and this is of the skull bones. And more frequent examination is only undertaken if indicated. So the frequency, you can say it is increased only if there are some indications. Next, when we go ahead, the charting, it starts at, when does the charting start? So the charting, it starts at 4 centimeters. It starts at 4 centimeters of the cervical dilation. And what about the color? The color of liquor. The color of the liquor. The color of the liquor, it mentioned as the C. C means it is clear. And B for the blood. B for the blood stained. And then we have M. And M, as we know, it is nothing but the meconium. So just to write it down, M is for the meconium. Then we look at the molding. What is molding? So the molding, there are some gradings which we need to know. So the molding, there is grading from 0 to 3. So there is 0 to 3 plus grading. So in terms of 0, the 0 means that the bones are separated. So the bones are separated. It is separated and there are sutures. The bones are separated and there are sutures. It can be easily felt. It is easily felt. Then there is the 1 plus. So what is 1 plus? 1 plus means the bones are touching. And after 1 plus, there is 2 plus. So 2 plus, it indicates the bones, they overlap. So bones, they overlap. Overlapping of bones, but can be reduced. But can be reduced. So what is 3 plus? So 3 plus indicates that the bones, it severely overlaps. So bones, they severely overlap and they are irreducible. Then we move on to the alert line. So what is the alert line? Alert line. So alert line, basically it reflects the average rate. So it reflects the average rate. It reflects the average rate of the cervical dilation. So there is the average rate of the cervical dilation, and this is nothing but of the slowest quantile, of the slowest quintile of the term primi gravida. Slowest quantine of the term primi gravida. And next, if we look at if dilation slows or ceases. So in case if dilation, it slows or ceases, what is the condition? So in case the dilation, it slows or ceases, the partogram plot will cross the alert line. The partogram plot, it crosses the alert line. Then the alert line is at 4 centimeter dilation. The alert line, if you see, it is at 4 centimeter dilation, and it is and expected dilation of, there is expected of 1 centimeter per hour. Then we will look at the action line. What is the action line? So the action line is nothing but it is 2 to 4 hours after the alert line. So it is about 2 to 4 hours after the alert line. Alert line. And it prompts the innovation to accelerate labor. So it tells us whether to accelerate the labor or not. So it gives indications to accelerate the labor or not. And it prompts it prompts the innovations to accelerate the labor. That's what we discussed. And there are higher rates. There are higher rates of the perinatal mortality. Higher rates of the perinatal mortality. And it should be and it is associated with the delays. It is associated with delays of 4 hours. Delays of 4 hours or more after the alert line. So what are the contractions? If you see, it is the contractions. If you see, it is measured. It is measured for a span of 10 minutes. It is measured for span of 10 minutes, and the duration is noted. Duration is noted, and it is measured for every 30 minutes. So every 30 minutes it is measured, and it is marked with a dot. It is marked with a dot. Next, we're looking at the blood pressure. How is the blood pressure into consideration? So the blood pressure, if you see, it is recorded every 4 hours. It is recorded every 4 hours. The blood pressure is recorded, and it is marked with arrows. So it is marked with arrows, arrows, and unless the patient has a hypertensive disorder or preeclampsia, in which, so in cases of the preeclampsia, or in cases of the hypertensive disorders. So in such cases, it is recorded every 30 minutes. It is recorded every 30 minutes. Next, what we see is the temperature. So the temperature, if you see, it has to be recorded every 4 hours. Temperature is recorded every 4 hours. Next question. Next thing, we are going to look at the WHO composite parthograph. WHO composite parthograph. So what is this WHO composite parthograph? It is nothing but a modification of the original parthograph. So it is nothing but a modification of the parthograph, and except the latent phase and charting. So the latent phase and the charting is done at 3 centimeters. Then we look at the WHO simplified pathograph. So WHO simplified pathograph. So the WHO simplified pathograph is the WHO. It further modified the pathograph for the skilled attendants in the healthcare workers. They simplified and it became color coded. It became color coded. So here, the area to the left of the alert line, there is a alert line. So the area which is left of alert line of the alert line. So this is in the cervicograph. So in the cervicograph. So this is colored green. This is colored green and represents the normal progress. So this is nothing but the normal progress. And then there is the area right in the to the right of action line. So there is right of action line. So this is colored red. It is colored red and it indicates dangerously slow progress. It shows the slow progress in labor. Shows the slow progress in case of the labor. And the area right in between. So the area in between. So the area right in between the alert and the action line. What is it? Alert and the action line. So what is this? So the area in between the alert and the action line is nothing but it is colored amber. It is colored amber. And what is this? This indicates the need for the greater vigilance. So it indicates the need for the greater vigilance. So now going back to answer our questions. So now we have a segment of answering our questions we asked. So the first question we asked was, what is molding? So if you see molding, it is we need to know that there is different classes, that is 0 to 3 plus. So what does everything indicate? So molding of 0 score, it indicates that the bones are separated. The bones, if you see, they are separated and the sutures, they are can be felt easily and sutures felt easily. Then we look at the grade of 1. So what does 1 mean? 1 means the bones are touching. Bones are touching. And then we move on to the 2. What does 2 indicate? 2 indicates that the bones overlap. Bones overlap. But can be reduced. But can be reduced. The third thing is that the bones, they severely overlap. The bones, they severely overlap and are irreducible. So next, the second question we asked was, what is the alert line? So the alert line was nothing but it reflects the average rate of cervical dilation. So it reflects the average rate of the cervical dilation of what? Of the slowest quantile of the slowest quantile of the term primi gravida of term primi gravida. And if dilation slows or ceases, we need to know that if dilation it slows or ceases, what is the thing? The Partogram plot. In such case, the Partogram plot, it will cross the alert line. It will cross the alert line. And now we look at the alert line. The alert line is at 4 centimeter dilation and it can expect a dilation of 1 centimeter per hour. Next, we look at the action line. So, what is the action line? The action line, it is 2 to 4 hours, 2 to 4 hours after the alert line, and it prompts the innervations. It prompts the innervations, and this is to accelerate. It accelerates labor. It accelerates labor or performs the cesarean section. So another point to note is that the higher rates of the mortality, the in case of the higher rates of the perinatal mortality. So in cases of high rates of perinatal mortality, they are associated with delays of of more than 4 hours, after the alert line. So now we move on to some bonus questions which can be answered in the comments. So looking at the bonus questions, the first question we would like to ask is, talk about the vaginal examination in the partogram and how significant is it. The second question will be, talk about the measurement of the blood pressure as well as the pulse and temperature. So how are they measured, and what is the frequency of measurement, and what is the significance, and what are the treatment in case of the alteration of the same. The next question will be, what is the WHO composite partograph and how different is it from the simplified partograph? So these answers can be given in the comment section.